On our ground floor, we have 4 classrooms that can be divided into different size spaces. So we tend to keep them in these group work arrangements to help to facilitate interaction with the different courses. But we do move them around as needed to meet the needs of the faculty that are teaching that day. Each of these rooms has screens that can be seen from no matter where people sit. They also have a whiteboard and a flip chart in every classroom. And right now, the space that you're seeing is 2 classrooms open together. There's 2 other ones on the other side. And we can comfortably seat 88 at our tables, and we can have the space to bring in extra chairs if needed for specific activities. This is one of our 2 identical skills labs that are side by side on our ground floor. So each has 4 beds on each side of the room, and in the middle there's a grouping of tables and chairs where they can do small group work, or we can even have small classes in here, as well as sometimes you'll find task trainers on the tables when we're doing a lot of skill teaching. We have audiovisual capability as well as the whiteboards and the flip charts with each of the stretchers. Behind the stretcher is a full Welch-Allyn setup with otoscope, ophthalmoscope, thermometer and blood pressure equipment, as well as the ability to monitor cardiac. Each also has 3 sets of gloves, small, medium, and large. We have actually real oxygen and real medical air here because our environment is set up to be converted to a hospital if there's ever a major crisis. These 10 rooms are used for a variety of purposes, including in support of the OSCE exams for the Arab and Qatari board. And we tend to have mannequins in here quite often, as the nurses specifically like to use these rooms for their general nursing orientation because there's an exit in the back. So it really makes the workflow easy here. And there's a little less noise than there is in the skills lab. So depending on what they're teaching, they'll come to these rooms. And as you can see, behind the bed is exactly the same as it is in the skills lab, with a little different placement of the gloves. There's also a sharps container and a bedside monitor for the mannequins. We recently just got our wall-mounted monitors, which will negate the need for the bedside ones. Each room also has more than adequate storage space, as well as a computer that's available for faculty or learners to use for documentation or to access information on the internet. We do have workstations on wheels that we're expecting anytime. Once those are commissioned, then we'll be able to work with our IT department to access the Cerner playground and create the charting documents for the simulated patients. This is one of our 2 moulage rooms. We have a male room and a female room, and these were designed to be used with standardized patients to prep them with their moulage. And so as such, we're not using it for that purpose yet since we don't have a program. But you can see we have been doing a little bit of moulage setup and work in here for different mannequins. These rooms also have changing rooms and lockers that can be locked by the person with their own code. This space is originally designed to be a lounge for standardized patients. We don't have that program up and running yet, so it's used by different faculty who come to teach here and people that need a quieter place to be. This is the back side of the same lounge, so yes, these chairs are really comfortable, and they do allow you to block out some of the noise and distractions, as well as a place for some small group work, and you can see some additional storage in here. I didn't point this out in our classrooms, but each of them also have these cabinets that are able to be locked that we can use for storage. In each of our storage rooms, we have a computer that we can access to Learning Space, which is what we use for our inventory management system. Then each item has a barcode and is scanned out to the location it's going to, and then it's scanned back in when they're finished with it. You can also see on here an example of how each of the items is labeled. This picture is at the exit of every one of our rooms where we use simulation. So because we're hospital-based, I'm greatly concerned that we not allow any of our simulation equipment or medications to get back into the hospital environment. So these pictures are at the exit to each room and the exit of the building. You can also see with our simulated medications, we tint them blue or green because we feel that that will decrease the risk. If somebody doesn't look at the label, maybe they'll notice the different color. So it's just one more attempt to make sure that patients are kept safe. This is our virtual reality lab.